Hello, I'm Dr. Cris Vieira with INDY VITAL, and I'm here today to talk about hyperbaric oxygen therapy and brain injury. More specifically, about brain injury that happens in our veteran population. Did you know that suicide among our members of the military and our veterans is now its highest it ever been? About 24 veterans kill themselves every day. This is a tremendous number of people that find no options, no choice. They feel that they're trapped, that there is no treatment, no escape from the situation they're on. And this is caused by brain trauma. During their training or during war, they're exposed to explosives, and there is the invisible wound or brain injury that happens and change their lives forever. Several scientific studies link the suicides to brain damage suffered by the vets during the war. In this video that follows this brief introduction of mine is a Spotlight on America video produced by the Chief Investigative Reporter Duane Pohlman. He examines hyperbaric oxygen therapy, healing veterans who suffered traumatic brain injury. And he also investigates why the military and the Veterans Administration has, let's say, yet to approve this treatment modality for the veteran population. Despite the absence of formal approval, numerous studies have shown that there is a benefit. This numerous DoD studies have shown over the past several years that there is an improvement when these veterans receive hyperbaric oxygen therapy for the treatment of brain injury. It is a very, very important issue that we can solve together. When I was in medical school, we were taught that there was no treatment for brain injury. That brain injury was pretty much final. Once the neurons were dead due to a stroke or a traumatic brain event or concussion, that was the end of it. Well, now myself and most of the physicians that do hyperbaric oxygen medicine believe that HBOT may reverse at least partially the damage that has been that caused the injury, and this has been shown consistently over and over again in several studies. It also is based on clinical findings of myself and other physicians in the field of hyperbaric oxygen medicine. According also to other veteran groups such as treatnow.org, a fantastic nonprofit organization which is dedicated to preventing suicide among our veterans, found that more than 4,000 combat vets have received HBOT, and that 8 out of 10, I'm going to repeat, 8 out of 10 veterans improved with the use of HBOT in the setting of traumatic brain injury. What else are we waiting for, folks? Let's get these veterans treated. Let's stop the suffering of these people that are committing suicide, that find no way out. At INDY VITAL, where I work and where I'm the medical director, we have 2 medical-grade hyperbaric oxygen chambers that are available to veterans that reside in the Indianapolis area. We have promotional offers, and we also offer discounts for our military and for our veterans. Well, thank you for listening, and please watch the following video after my brief introduction.
Went through hell.
Yes, sir.
For retired Marine Sergeant Major Simon LeMay, hell arrived in 2009 and 2010 in Iraq and Afghanistan. Improvised explosive devices, or IEDs, claimed one of his Marine brothers
And my best friend,
and maimed another.
about 5 feet from me, stepped on a pressure plate and lost both of his legs.
LeMay survived, but explosions left him with invisible wounds of war.
Had multiple IED exposures that have led to traumatic brain injury.
He returned home disoriented and numb, struggling to simply speak.
Was lost. Truthfully lost, and just really didn't have a desire and a will to want to keep going each and every day.
Military doctors treated his symptoms. LeMay descended into deep depression.
Do you have that gun at your head, sir?
I did.
His aunt and uncle stepped in, convincing him to try an alternative therapy. Hyperbaric Oxygen Therapy, or HBOT, which has healed thousands of combat vets with traumatic brain injuries, or TBI. HBOT involves pressurized chambers pushing 100% oxygen into damaged sections of the brain. MRIs reveal brains light up after treatment. The FDA approves HBOT for treating 14 injuries and conditions, but not TBI. The Department of Defense and VA are evaluating, but they too have yet to approve HBOT for TBI. A VA spokesperson writing, "There is insufficient medical evidence to recommend HBOT as a treatment for traumatic brain injury." Yet numerous DoD studies over the past 7 years reveal significant improvement for combat vets suffering from TBI. Dr. George Wolf, who was the medical director of one of those studies, made it clear.
Does hyperbaric work?
I totally believe it does.
What we're all taught in medical school, there's nothing you can do for brain injury.
Dr. Paul Harsh was among the first to say HBOT heals injured brains. He says he's been frustrated for years with the military's refusal to accept HBOT as a viable treatment.
And we can treat brain injury. And look, here's the evidence.
According to veterans groups, more than 4,000 combat vets with brain injuries received HBOT, and 8 out of 10 of them are showing significant improvement.
And I was losing it all because of the brain injury.
In Afghanistan in 2005, an IED exploded under an armored Toyota SUV carrying Brigadier General and Judge Pat Maney. He suffered a traumatic brain injury, which made it difficult to walk, talk, and think.
I could read words, but I couldn't process what they meant.
General Maney was treated at Walter Reed Army Medical Center for 15 months.
Their advice was tincture of time. Just be patient.
But time was not healing his wound. Powerful people, including the former Secretary of the Army, pushed to get General Maney HBOT treatments. After 120 sessions, Judge Maney returned to the bench in Florida, where he started Veterans Court to help injured vets avoid criminal prosecution. Now, he's running for the Florida House of Representatives.
I'm a survivor thanks to hyperbaric oxygen therapy.
For Sergeant Major LeMay, treatments, which continue without the help of the military, have given him hope.
I found myself looking to a future.
Yet more than 1 million veterans with TBI are suffering, while the military and the VA continue to study whether HBOT really works.
I think it's just absolutely crazy that we can't give everybody the chance that I've had.
For Spotlight on America, I'm Duane Pohlman.